Hey everyone, it is Dr. Nurse Tutor. I'm back with another video. This video is going to be a nursing exam question. All of my pathophysiology students as well as my adult health students. This is going to be a question that will help you as a possible question that may be on your exam. It is also a select all that applies question because everybody hates select all that apply. Okay, so I'm going to go ahead and read the question and then we're going to break down and rationalize why the answers are the answers or why the answers wouldn't be the answers. So it says an elderly male in age 90 years old was admitted to the medical surgical unit with vomiting and diarrhea and fluid volume deficit. Clinical manifestations of this problem are ? Select all that apply. So the patient is 90 years old. Right? So we already know that this is an elderly patient, and we know with elderly patients, they start to decline and they start to decline fairly quickly. And with the elderly, because their organs are aged, their organs are diminished, they're going to become dehydrated more quickly than someone like you or myself if you are not an elderly person. So understand, especially from pathophysiology, that the elderly and babies run a higher risk for dehydration just because of their age, especially the elderly because their organs are aged, right? And also they tend to have lesser fluid volume. Their kidneys and their livers can't process and remove toxins or filter out waste as effectively if they were younger. Okay, so the first thing is your patient is age 90 years old. Your patient is an elderly patient, which would put them at risk for dehydration. Next, your patient has both vomiting and diarrhea. Your patient is losing fluid because they're vomiting, and your patient is losing fluid because they have diarrhea. So they're going to lose fluid volume. Fluid volume is necessary in your blood. Fluid volume helps to maintain your blood pressure. Fluid volume helps to maintain your heart rate. Fluid volume helps to maintain perfusion of blood to your tissues. So if we're losing fluid volume by vomiting and having diarrhea, your patient runs the risk of becoming dehydrated. So it's important that you understand the manifestations of dehydration as well as fluid volume overload to understand what the answer choices will be. You just have to know that, okay? So the answers below say weight loss, dry, rough mucous membranes, distended neck veins, cyanosis, and decreased central venous pressure. Understand that if I'm going to lose fluid from my body, I'm going to lose weight, right? If you've taken pharmacology and you understand anything about diuresis, or someone who is excessively urinating, if you're losing volume and you're losing fluid, you're going to lose weight. That's why every time we give somebody a water pill, we weigh them. Same thing where if we're vomiting or we're having diarrhea, excessive diuresis, you're going to end up losing weight because you're losing fluid volume. So that would be an appropriate answer. The next one says dry, rough mucous membranes. Once you understand that your patient, by losing fluid volume, runs the risk of dehydration, you should already know that with dehydration, your patient is going to have dry, rough mucous membranes. Okay, that's what we look for. We're looking for dry, rough mucous membranes whenever we think that our patients may be dehydrated, and also understanding that skin turgor test. So if that was also an option, that's what you're looking for dehydration. So dry, rough mucous membranes also sounds like an appropriate option to choose. Next one is distended neck veins. Distended neck veins, if you know and understand from pathophysiology as well as adult health, patients with distended neck veins, that is not dehydration. Distended neck veins is associated with fluid volume overload. So if someone had fluid volume overload, they would have distended neck veins, they would have the edema, they may also even have some pulmonary congestion because they're in overload. Okay, if you're dry, you won't have distended neck veins, so that wouldn't be an appropriate answer. The next one says cyanosis. We can't really determine whether or not if this patient has cyanosis, because if you remember from pathophysiology as well as adult health, if someone has cyanosis is related to hypoxia, right? So that would mean that we have a lack of oxygenated blood. Nowhere in this question does it say that this patient can't breathe, his pulse ox is low, none of that. So cyanosis wouldn't be something we would be looking for. We would more so be looking for anything related to dehydration. So cyanosis, I don't really care for it. The last one says decreased central venous pressure. I like this one. Decreased central venous pressure means how is the preload going to look, right? Because we already know when the heart ejects blood away from, when blood is ejected away from the heart, we have to perfuse our organs, right? But if my fluid volume is low because I'm vomiting and I'm having diarrhea, What is my preload going to look like if my fluid volume is low, right? What is that venous blood return going to look like? Am I going to be able to have enough blood for preload? If I'm dehydrated, if I'm losing fluid through vomiting and diarrhea, you're probably not going to have enough fluid volume in circulation, which is going to negatively affect blood returning back into circulation through venous pressure. So your patient is probably going to have decreased central venous pressure. Anything that causes fluid volume loss, you're not going to have effective perfusion. You're not going to have an effective blood return. You're also not going to have effective blood ejecting from the heart and perfusing your tissues as well as your organs. Okay, so whenever your patient is dehydrated, understand we're losing fluid volume out of circulation. Your patient is going to be dry. Your patient is going to lose weight, right? You're going to notice the dry, rough mucous membranes. You're going to notice that your patient's weight is different from maybe a couple of days before if you've seen them or if they're in the hospital. They're not going to have distended neck veins because that would be fluid volume overload. They're not going to have cyanosis unless maybe we check some vital signs, but there's not enough information to let us know that our patient is cyanotic. But you will see decreased central venous pressure because if the fluid volume is low, how are we going to have effective central venous pressure for the preload blood returning back into circulation? All right, so I hope this helped. Understand when you're looking at the question, you got to understand what the question is asking you to be able to answer the question, right? The age of the patient. We already know by the age of the patient, they're at risk for dehydration. If they're vomiting and they have diarrhea, they're at risk for dehydration. If they're doing both, they're at a greater risk for dehydration. And then it's telling you fluid volume deficit. You should already know that fluid volume deficit means your patient is at risk for dehydration. So once you understand that from the question, you want to do a process of elimination. What out of these answer choices look like dehydration to me if a patient came in and they had fluid volume deficit? Weight loss, dry, rough mucous membranes, decreased central venous pressure. You're not going to have enough fluid volume coming back into circulation if we're losing fluid volume by having diarrhea as well as vomiting. Okay, so I hope this helped. This is Dr. George with another nursing moment, another nursing question. I hope this question helped. I will have more questions coming. I have a lot of students who are getting ready for exam 1 in my class, as well as older students who I've had in other classes. So I hope this question helped. If you do have any suggestions on topics that you're struggling with that you would like me to do a practice question on, just leave some comments below and I'll make sure to get back to you guys. All right, bye-bye.